it basically says, basically this midway between flexion, extension, abduction, adduction. So just kind of sitting out to the side there. Let's have someone come up again here. And turn, yep, that's perfect. So, remember, we gotta find the CMC joint first, right? Remember, we can find that by kind of finding the scaphoid. Good?
Yes.
Find the scaphoid, and we kind of work down trapezium, find that joint line, and we're kind of gonna move that a little bit. So we're gonna kind of stabilize there. So we've got ulnar and radial deviation. So ulnar, kind of again, toward the pinky side, radial this direction. Ulnar is going to help radial adduction of the thumb. So I'm just here doing, so I'm going to do a little distraction, and then I'm going to push down, all right? So this hand is kind of stabilizing trapezium, right, scaphoid area. This hand then is going to provide a little distraction. Now we're starting to get pretty small surface though, right? I want to make sure it's happening just at the joint line. So I'm really not tugging on her thumb out here. I'm really trying to envision right at the joint line. I'm trying to envision the motion right at the joint. In my case, I'm using my thumb to basically, because my thumb is as big as her thumb, I'm using my thumb to push her down, okay? So that would be ulnar. The opposite of that, I'm gonna take my two fingers here and pull up, right? So I'm going radial, so I'm kind of in this position. Everything stays exactly the same because I'm gonna generally do these opposite of each other. So I'm here and I'm pulling up. So what's generally gonna happen is either I'm pushing down or pulling up, pushing down or pulling up, okay? So that's ulnar and radial deviation, all right, of the thumb. Then you have a dorsal and volar mode, kind of the same concept, but instead I'm going again back that way and that way. So previously I was kind of doing these two directions, now I'm doing forward and backward, all right? This helps, so a dorsal glide, so if I'm here and I'm coming backwards, dorsal glides helps palmar abduction, volar glide, palmar adduction, right? So palmar abduction with a dorsal glide, palmar adduction with a volar glide. Remember, that's palmar ab and adduction, right? So that's the motion we're trying to help there, where they lift their finger off the palm. Let's go to our fingers right quick, and because it's pretty quick. So we're talking MP joint or IP joint of the fingers. Those are open pack position of slight flexion. So in this case, we're trying to help either flexion or extension. That's what those joints do. So we can do a distraction. In this case, if we're working on the PIP of this, distraction literally means I'm just pulling it apart. That helps flexion or extension, right? We can do a dorsal glide. Dorsal glide would mean I pull it apart and I move it posteriorly. That's going to help extension. Or we could do a volar glide, meaning I pull it apart and I move it volarly, which helps flexion, okay? So it's simple as pull apart, and again, we're going to usually do those in combination. We're going to pull it apart and move it volar and dorsal, volar and dorsal. The only time we wouldn't do that is if we have just a really isolated restriction, all right? So let's do the CMC and the finger, and then you got about 7 or 8 minutes to do that.